Can everybody hear me with the noise, with the music in the background? Yeah, I'm wondering, Will, how can we get that to turn down? What did you say, Eleanor?
You can unmask at the mic.
You think so? Yeah? With all this yucky? All right. Okay. Dr. Quo, he's the man. Colleagues, good afternoon, good evening, good morning, and welcome to this press conference. We thought as a Board of Education and as Superintendent of Schools and out to our considerable community of over 150,000 parents, relatives, students, families, members, and the extended family, that this message today and this conversation today is very important. It's important for us to communicate accurately and also keep the conversation alive as we continue to grapple with and attempt to struggle toward, hopefully, an endemic time sometime. But it's not right yet. It's not yet. So this conversation this morning will be in three parts. First, I will state very clearly what our aim is and what it always has been. Dr. Quo will come up and talk about the status of the Delta variant in Erie County right now and some of the factoids around that variant of COVID. And he'll talk about what BPS's strategy has been and how, in his opinion, professional opinion, and in the opinion of his colleagues who we rely on, we call it our medical advisory team, to make decisions of consequence for the district. We rely on our medical advisory team, and he will talk about how so far we have done a probably best-in-class, commendable job in containing and mitigating the spread of this awful disease inside our schools. And then the second part, we'll talk about questions in relation to Omicron. We've got to have a conversation today about Omicron. Yet unknown, its total, what it does, how fast it spreads, what its degree of illness is in people, let alone children, and how effective are the tests that are being made available with catching Omicron and then helping us to, again, mitigate the impact of it. And then last, we'll finish with back to the main message. Board President Lou Petrucci will stand and speak what the aims of the board are, what the board would like to see at this time, and then I will reiterate some directions about where we will be in the coming weeks with our school system. All right. So, three parts. Here's the first part. First part is, colleagues, that Buffalo Public Schools need to stay open. They need to stay open 5 days a week. And in our case, we have our 6th day of Saturday academies that are thriving, and students and parents enjoy coming to those enrichment opportunities during Saturdays. We must stay open if we can. We need to stay open. No question about it. No one wants to go back to remote learning. We don't. If we learned anything over this past year, is that remote learning was a necessity, but it is not optimal by any stretch of the imagination. Parents know that, students know that, and certainly teachers know that. So they're back now. Our students are back with us. And we still have many, many challenges to continue to get them back up, back on track, heal, progress, and then thrive. We're not there yet, but it's clear that all of our students, complex population that we have, must be in school. So I want that to be clear. That's our goal. Now, Dr. Quo will tell us about what the status is right now with this pandemic here in Buffalo, Erie County, and what we need to do to continue to mitigate the spread of it so that our children can stay in school safely.
Good morning, everyone. I am very, very pleased to see so much interest in supporting our communities, our schools, our families, our students, our teachers, and staff. This is a very unprecedented situation, given the spread of Omicron, but we have learned a tremendous amount over the last year and a half about how to keep students, teachers, staff, families safe within schools. We have incredible partners. I am indebted to the dedication of all of our colleagues at Buffalo Public Schools, particularly our principals who work so hard every day, our colleagues at the Erie County Health Department, and our state partners, and all the members of the medical advisory team. Make no mistake, our children need to be in school. And the context over the last year is that the tools that we have had to be able to keep our kids safely in school and our understanding of how this virus works has really grown tremendously. We reopened last year during a wave of, and we kept them open during the Alpha variant. So there's been different variants that have come through over the last year and a half. And then this year, as the Delta variant was coming through Erie County, we reopened the schools fully 5 days a week, and we kept them going. And now we are on the downside of the big Delta wave. There are a lot of cases throughout the county. There are a lot of cases in the city. And the multi-layered approach that is recommended by the Centers for Disease Control and the American Academy of Pediatrics, we mask. We make sure that there is adequate distance between all of our students and teachers and staff. We look at ventilation, we look at flow, we make sure that we ask folks to stay at home if they are sick. We have a screening testing program that we have also rebooted better than ever with the help of the Erie County Health Department. We have extremely strong protocols. They are by the book. It's everything that the Centers for Disease Control and the American Academy of Pediatrics recommend. Our medical advisory team looks, in partnership with the County Department of Health, at every case that's associated with a Buffalo Public School. And we know there are no outbreaks in the classrooms. We know that when cases rise in the community, that they stop. So all these cases that we see, they're being transmitted in the community. As we have learned more and more throughout this year, some of the guidance has continued to evolve as the science has told us more and more about what keeps students, teachers, and staff safe within the schools. We know that the virus is not being passed around in the schools. We know that because when we see cases, they pop up in different places. Sometimes we get reports of cases clustered with families, in which case we know there's household transmission. And then they stop. And so when all these cases pop up different places, we know it's not being transmitted in schools. They're coming from outside. So we've learned a lot, and we went through our Delta wave, and the mandatory masking that we have within the schools and now outside the schools and indoor places really has contributed to the drop in cases, and we need to get Delta as low as possible. I'm very, very happy to echo what our colleagues at the County Department of Health has said, is that our test positive rate in the county is the lowest in the region, and our cases have dropped week after week. And we need those cases to go down because we know that the Omicron variant is coming. My discussion with Dr. Cash, the Board of Education, to all of our colleagues, is that we will continue to watch where everything is. We know that children are safe in school. We need to make sure that our communities stay healthy as much as possible. We need to make sure that we adhere to our protocols. We need to make sure that outside of the schools, that we limit our gatherings, that we pay attention to masking, that we watch what we do. We need to make sure that we get vaccinated. If we are already vaccinated, we need to make sure we get our boosters. You know, we need to take advantage of the testing that we have in the community. And if we're sick, we need to stay home. Those are the measures that have worked, and they will continue to work. And if we adhere to those when the Omicron variant comes in, we'll be fine. But we know that the Omicron variant behaves differently than Delta. And what it's doing, what we're watching in New York City, as well as what we're seeing from Europe and South Africa, is that this variant is far more contagious, which means it spreads more quickly. And so even though we went through a large Delta wave and we kept the schools open, and we know there's no spread in the schools, and we know that everyone is really committed to doing the right thing for our kids, this virus, the Omicron variant, just spreads that much more quickly. And so what we're seeing in places that are already seeing a lot of Omicron spread is that the cases go up very, very quickly for a short time, and then they go down. But when it's going up and you have a very high peak, a lot of people get sick. Now, the vaccines will help. The vaccines will keep people out of the hospital. The vaccines will make sure that your illness is mild or non-existent. But this virus will spread. And so even though we know that the schools are safe and these protocols, we have every indication that these protocols are working and they will continue to work, the very, very fast spread that we will see with Omicron, that we anticipate will happen in January, is something we have to keep a very, very close eye on. I do want to call out just the incredible work that we have done as a community. We mask, we check everybody's symptoms, and we check temperatures at the door. We work very hard to keep that virus out of the schools, and we continue to do so. These strategies will continue to work. And as long as we know how well they work, and we have so many more surveillance tools to make sure that the virus will stay out of the schools and the virus will not get passed around in the schools, we continue to operate business as usual. But this is a rapidly changing situation. We are watching what's going on in New York City. We are looking at their absentee rates. We are looking at the impact it has on staffing and students. And those are things that we're going to be looking at in addition to the numbers. The state has given us a lot more tools for us to consider and utilize over the coming weeks to months. Some of those have already been announced by the state and by the Erie County Department of Health. Things like additional rapid tests coming, things like rapid tests coming to the schools, and we have been in discussion with the Erie County Department of Health. Things like the Test to Stay program, which the Erie County Department of Health has been testing with the Grand Island School District. These are things that the science and the experience has continued to evolve, and we are continuing to look at the state and the county for additional guidance for how this works. I do want to emphasize a few points, though, as we consider the operation of our school district. The first is that the vaccine, if you are vaccinated, then the need to test to stay is not an issue. Because if you are asymptomatic and you are vaccinated, then test to stay does not apply as long as you have no symptoms. The second point is that the masking, the distancing, all of the protocols that we already have need to continue so that we know that the virus does not enter the school, or if it does not pass around. Those are our mainstays. Those are what we have worked. Those are what we're going to continue to do. We are evaluating the influx of the rapid tests. We are evaluating what test to stay could look like. but those are secondary considerations compared to masking, protocols, staying home when you're sick, and getting vaccinated. So my ask is that as a community, that we continue all of these protocols. I'm very proud about our community being strong with the protocols. The level of virus in the community dictates the level of risk in any school setting. If the cases are low, the risk in the school are low. If the level of the virus in the community is high, then you have to layer more and more protective layers. But these are layers of protection that Buffalo Public Schools has continuously maintained and will continue to add as we understand more and more about what we can do to keep this virus out of our schools. So we need to continue what we're doing. My advice is that we are committed to absolutely keeping the schools open. We will continue to watch where everything is because this is a very highly rapidly changing situation. But we have the tools, we have the protocols, they're very, very strong. We want people to be healthy, we want to wash themselves carefully during the holidays, we want folks to be vaccinated, get boosted, stay home if you're sick. Make sure you sign up and participate in our screening testing program so that we know what is going on within our school community. We're ready, and we want the schools to be open. Thank you.
So, colleagues, that was Dr. Quo. We follow his advice and his team, the medical team. The second part, or the third part, whatever I said at the beginning, will focus on some questions and some concerns that I have as I continue to make important decisions on behalf of the district for the second largest school district, complex school district in the state. And here they are. First, is the state shifting, making a policy shift from vaccination, masking and vaccination, which is what it was a few weeks ago, to masking and testing? And I have some concerns about testing at the level that you would have to test in a school district like ours, for example. The pilot in Grand Island, it does not tell me anything. I'm not convinced, I'm not persuaded, the data doesn't even look right. What does it mean 193 students over a 2-week period were tested and only one was positive? I don't know what that means. So for a school system like ours that has 31,000 students, 10,000 charter school students, and we look at Buffalo Public plus charters because we serve charters as one student population, another 10,000 staff between charters and Buffalo Public, and then the extended family. So how many tests in this Test to Stay program, which is very embryonic and unclear in terms of the effectiveness of it, even though there's one person out there that's happy about it, somebody that's constantly talking about how effective it is. How many tests does a family get? How many tests will we get? Because I have 31,000 children. I have 50,000 staff and students. Do they get one test per family? Do they get 5 tests per family? My understanding is you have to test positive in consecutive days. It's not just one time I'm negative and I'm good, because you could have been a false negative. And so you need to test consecutively. So how many tests will a family receive when we're talking thousands? And you can see how you do the multiplication. You can get to 1 million very quickly tested the Buffalo Public Schools alone needs over just a short span of time. So how many tests will Buffalo Public get as we try to mitigate and help students to stay in school? Because I want that, I'm interested in it, but what does that look like operationally? Second, the Erie County Department of Health has been stressed throughout this pandemic. I've seen it firsthand. Their capacity is very limited. to do the things that it needs to do. It needs to contact trace, needs to let us know timely, and cannot be getting into backlogs if we shift to all of this testing that we're going to do. And already I can see that we're in a backlog. I have a key staff member, has tested 4 days in a row, has not heard about her results yet. The 3 antigen tests she heard pretty quickly, the PCR test, still waiting on results. That kind of pace won't get it for a large school district. It just won't. And so I worry about capacity to do all of this testing. And then I would like to see, before we come back on January 3rd, all of our families and staff to be tested. So we know coming in, they can all report in, we've been tested and we're negative. See, that would be helpful. But that needs to start soon. We only have 2 weeks before we come back. Can we get tested before we come back to help alleviate the anxiety that many staff have about coming back after the winter break and all of the assembling that we know is going to go on, even though we were advised to keep those celebrations, keep those contacts low. It's an important question. Go a long way for me to make the decision confidently. And then I won't go further for now, but what I will say is that there is going to be a spike in our conversation in January. Similar to last year. We had a spike last year after this winter break. Didn't happen the first week, but it happened the second and third week. Is that what's going to happen again, and what will that look like? How many will be affected? Because it's not just keeping the kids in school, colleagues. I've already asserted that that's absolutely what we want to do. But I also have staff that are starting to feel, and I'm starting to see the impact of COVID on their absences, on their health, on their taking time off. And I'm at a tipping point for 10 major divisions of staff in this large school system. Bus driver shortage has been acute from day one. It may get even more acute, we're told, from our executive director during the winter months. Our food service workers, our custodial staff, our teacher aides and assistants, our teaching staff, because substitutes, I'm having to hire more and more substitutes, and yet there aren't the population of substitutes that are taking the job to help us. So I'm running into staffing shortages across the board. And if you have a tipping point of staff shortages, then at what point do you say you have to shut the schools because you don't have the staff to operate them effectively for the purpose they're intended? We're not just babysitting institutions. We're there to help students achieve, work on their whole child and their whole development, and all of the services that our students need, because we see it every day. And so the staffing issue has to be considered. And if I can't get the tests, if I can't get the vaccines and the consent from parents to get more of our students vaccinated, because not nearly enough of our 5 to 12-year-olds, for example, are vaccinated, then that adds additional stressors into the matrix of decision. So those are things that I have concerns about. Certainly will be in weekly contact now, because Dr. Quo said, let's take another look at this next Tuesday, and then I'll come back and we'll make a final call at that time regarding post-winter break school proceeding. All right, I'd like Board President Lou Petrucci to come up, state sort of what his understanding of the board is at this time, He's heard from us as day-to-day management and medical advisory team, and then I will close the session with 2 or 3 last points of emphasis. President Lou.
Thank you, everyone. As you know, this is a very important concern for the district, but our primary goal is to keep children in school. I know that many of my board members yesterday reached out to me directly. They had received calls from parents in the community that parents want their children in school for a variety of reasons. First and foremost, academic achievement. They want their children to benefit from that high-quality instruction that they receive from teachers, teacher aides and assistants, and principals, vice principals, everyone who's involved in the education of our children. And that's very important. Parents are very sensitive to that issue. Overwhelmingly, to a person, every single person that reached out to me and my fellow board members stated that they want schools to be open, but we have to make sure that we do it safely. So safety is always our concern as well. And part of the reason why we've been able to have this consistent path, of why we've been able to operate, is that we've had fidelity to these robust protocols that we've had in place. The masking, the distance, the vaccination, on and on. And the majority of our families have been very responsive, and we've been very lucky. The majority of the positive cases we have seen have been community spillover, because what happens in the community spills over into our schools. But we've been very good, and that is our goal. Our objective from the board perspective is to keep our schools open, to keep our children in school, to get that very valuable seat time that is directly related to academic achievement, but also acknowledging and realizing that when we shut down a school or a district, it places stress upon our BPS families. They have to find childcare. They have to, make arrangements with work. They have to, their unexpected or unanticipated absences that have a very direct impact upon our BPS families. Many of our families, they are a single parent with 2 kids who may not have that option to take a sick day or a personal day or vacation day, and it directly goes into what their income is and what their earning potential is. And that impacts many of our BPS families at a time when many of them can ill afford it. So again, the goal is to keep our schools open, to keep them open safely, that we are very happy with the fidelity to these robust protocols that have enabled us as a district to have this consistent path that have enabled us to keep open. Yes, we do have, not just us, but we are impacted by the labor shortage, as every district is in Western New York. But we've been able to work through it, and we will do our best to hire more bus drivers, to hire more bus aides, to bring on more substitute teachers, to bring on more staff. Can't do much with the supply chain, but aside from that, we are doing all we can to keep the schools open and safe, and to trying to provide the highest quality education that we can for the children of the city of Buffalo. Thank you.
Thank you, Lou. All right, colleagues, so there it is. Clear, concise, what our goal is. We'll close with these important points of emphasis. I grew up with these 5 Ps. I always recite it. 5 Ps. Proper preparation prevents poor performance. 5 Ps. Cabinet knows it, staff knows it, everybody knows it. This always was a point to be prepared. This was a statement of preparation. But it also speaks to Board President Petrucci's emphasis on academic achievement. So I will continue to ask and expect all students to take their computer devices home. They all have one-to-one devices assigned, and so they should take them home. Teachers should take their devices home over the winter break. First and foremost is because we want to continue students having the opportunity to do and practice all of the enrichment activities that we have as applications in our instructional system. They're new, relatively new, acquired during COVID, and they are wonderful. So students need to practice, they need to enrich their literacy and mathematics skills, for example, and other content, and then go ahead if they put the time in. And they can do that. Parents can work with their children to do that, and all of this information will be online. The teachers, again, simply for preparation. We don't know what will happen in the next few weeks. We don't. It's been clear to me. But we need to be prepared. Whether it's the week after the break, whether it's 2 weeks after the break, 3 weeks after the break, or never after the break, we need to be prepared. And so I want us to get facile and agile with taking our lifelines, our academic lifelines, home and back to school, school and home. That's what that was about. As of now, today, we expect to return on January 3rd. On January 3rd, everyone, and resume school under the strict adherence conditions that Dr. Kuo has outlined. That's as of today. I will give one more update on next Tuesday. We will be one more week closer to seeing the rapid advance of Omicron. I will consult with the board, and then we will have a consensus agreement on where we should go from here relative to the start of the winter break. I'm sorry, coming off the winter break, the start of January. January is going to be a tough month. January is going to be a tough month for all of us around the country, but especially the large districts, the large urbans. And so let's keep an eye on it. I'll be communicative with you. We'll be prepared to answer any questions you may have at any time. We'll be very fluid in our communication, and let's do the very best we can to continue to navigate this difficult time that we live in. So thank you for your attention, colleagues. If you have any questions, this is the time to ask them, or we will otherwise close the session. And if we could keep them on topic, please, that would be great.
Absolutely.
On topic.
You mentioned you want all families and staff to be tested before they come back.
I would like to see that.
Right. What are you prepared to do to get that done? Would that become a mandate? Can you just kind of expound a little bit more on that want?
Well, thank you for that question, and Dr. Kuo, you could assist. The idea is for a large school district, if we're going to receive all of these tests, sounds like a large number. Federal sending millions. Governor Hochul has promised at least $2 million to the districts, but there's 70-plus districts. And so our district is one of the largest, and I can tell you we can get to 1 million tests pretty quick. So what does it mean to test everyone to make sure that they are negative coming back into school? We're prepared to do whatever we're prepared to do, but my understanding is those will come to the county. The tests come to the county. So the real question is, what's the county prepared to do to get the tests either to us in kits so that we can take them home tomorrow, or somehow have students be able to get them over the break? Because remember, we don't have the same capitalization that some of the suburbs have. Our parents don't all have cars. Only a fraction have cars and easy transportation to come get or to pick up and that kind of thing. So I got to understand the dynamic and operationalization of this testing that we're talking about. Even if it's test to stay, what does that mean if I have a lot of cases coming off the break, or before the break, they start to say, the county says we've got an uptick? Because I average 50 to 60 cases a day. Who then are exposed to that even while we're in school? And so where are we with testing all of those people who were exposed? So that was my question. We're prepared to do whatever we can do, but the real answer will come from the county and from the medical professionals.
Eileen Buckley, WGRZ-TV. Dr. Cash, it almost sounds like with the staffing issues that you're dealing with, would that be the concern of those who cannot come back? Many staffers can't come back as well. I mean, is that where you
It weighs into the matrix of decisions. Yes, it weighs into it. But it's not something that I'm saying right now is causing me to have to close on January 3rd. I'm saying as this Omicron continues to build, And Delta is down. I heard say it's down, but frankly, colleagues, it's down from a very high level. It's very high. It's on Mount Olympus, so now it's down to the first or third base camp. But it's not down here at sea level, okay? I want to be clear about that. And so when you have that many cases still out in the community, it's going to affect our families. So to come back safely so that all the teachers and staff can feel like they're not just coming back in and risking getting infected from wherever they've come from, and our students and their families setting their child back into something that will come from the community. That's an unknown for me right now. But what I can tell you is, even under normal times, my bus drivers come down during winter, right? It's the flu season. A lot of my kids have asthma. A lot of kids are showing respiratory illnesses right now, in addition to, or not on top of, but over here. So those are all things weighing on people getting sick. And I've got staff that are out sick with COVID right now. And so their family members are taking tests, but it's taking time to get the results back. Because antigen tests alone has false positives and false negatives. How many are considered good before the county will say you're good to go? So county got to weigh in on some of these answers for me, okay? But those are good questions. Staffing will be an issue. I hope it's not to the point where I have to close, because we've been managing through, as President Petrucci has, but it's not been easy. It's not been easy.
Emily, WGRZ-TV. Dr. Cash, in the event that schools do not reopen on January 3rd, what do you say to parents who are worried about childcare?
Yeah, well, that's why I wanted to make the announcement sooner than later if I make it. Right now, Dr. Kuo is saying we should be good to go from his medical and professional opinion on January 3rd. So right now, I haven't said that we're going to do it January 3rd. What I've also heard is it's going to take a couple of weeks, possibly 2, but 2 will be a lot different look on this than what it is right now. And so then he and his colleagues will consult with me, I will consult with the board, and we'll say when, if we have to, it should be. But we're hoping we don't have to. He's saying that if we stick to our protocols, if we stay exemplary as we've been with how we have tried to mitigate through, we should be able to stay open. And that's what I'm hoping. But we don't know enough to say for sure that we're just good to go. And so then we will try to help and make as many good arrangements as we can. We had an arrangement last year where kids whose parents couldn't be home with their kids because of work responsibilities, we worked with, I don't know if Dr. Cresses is here, but we worked with local centers, community centers, churches, and other entities to take children who could work on their work while their parents were at school. But again, that's last case scenario, that's worst case scenario, and it is not at the forefront of our planning right now. What we're simply doing is trying to be prepared for eventualities. It just makes sense to me. And I think we're not the first district that will be doing this as the weeks unfold in the weeks ahead. So, great question. We share the concern, but we have to have public health. Public health trumps everything. Public health trumps everything. And I'm sure parents would agree. Who?
Dr. Cash, our understanding is the state hasn't provided any kind of guidance to school districts
Right.
about this issue. Is that complicating your decision-making on tests this day?
Great question, Steve. I mean, colleagues, to be blunt, we're on our own. School districts have been on our own since March 2020. And what that means is we'll do this, we'll support, we'll help with that, we'll give guidance. But the decision to close, the decision to remain open, the decision to close a classroom, the decision to close a school, that all resides with individual school districts. And so counties have been clear about that. State has been clear about that. And so you have to look at the matrix of information relative to your school district. And again, we're doing very, very well for example, at this level. But I'll give you a simple example. We're now into winter season for sports, for example. Sports is such a big deal in Buffalo, New York. I never thought it was in the South only. But anyway, sports, big. And so the suburbs, when we play them in basketball, volleyball, you know, got to play, got to keep playing, got to keep it alive, keep it alive. But they're not wearing any masks. Our kids are the only ones wearing masks. So now if we get infected, and my kids get infected playing sports, then what? Because believe me, this isn't something you play, sports like that, I know. I played. It's hard to play with a mask, a sport like basketball. It's hard to play football, certainly, with a mask, and so that's why we don't. But colleagues, the leagues, the professional leagues are pausing. They're shutting down. NFL, playing games on Tuesday. When was that ever happen? NBA, having to go hire substitute players. I'm just saying we're watching it, colleagues. Let's not be in a little bubble here. And I'm very concerned about it because it can spread from anything and anywhere. And this notion of an honor system, please, what does that mean? So I'm talking to you straight. I always will. And I will rely on science. But colleagues, we got to take this almost day by day, week by week, and I got to look at all of the issues that I'm confronted with on any given day. But I can assure you, my goal is to keep these kids in school. It absolutely is. But you can see, for the last couple of years, it's a lot of stress on school systems my size. A lot of difficult decisions that have to be made. Now, I'm built for it. I'm not complaining about it. But I don't just go with this either-or conversation. It's a very complex conversation. So thank you for that, Steve. It's a good question. And I haven't gotten the guidance I need, let alone the enforcement that I need in order for us to stay safe. And because I have a lot of students and families that still have not come to school because they don't think it's safe enough to come to school. So you have those parents that want schools to stay open no matter what. I get it. I do. But I have a lot of families that also say, I'm not sending my child anywhere near a virus that's raging and at the level that it is in this county. I'm not. My kid won't be safe. So it's a balance. It's always been a balance like that. It's not this is overwhelming and this. They want their kids in school, but they want to be assured that it's going to be safe in school. And we're trying to be as clear and fact-based, science-based as possible about that.
Emily's got Paul, Mary, do you have a question for go ahead, Dr. Hutchins, one more question. You mentioned that tipping point. What is the tipping point for staffing shortages in cases in which you would close schools?
I like that question. That's a good question. I don't have it down to a percentage, but what I do have it down to is classroom doesn't have a teacher because the teacher's out. It's an everyday class. It's either a core subject or a homeroom. And I can't find a substitute. So who's managing, who's minding the kids, so to speak? And I'm starting to see pockets of that across the system. And if we can keep it so that it's balanced like that, then we can keep schools open. But if winter brings a heavy dose of, for example, flu, and Dr. Quote, again, you would know better, but I heard that the flu quadrivalent this year is not effective. It's not the right one or whatever. I just heard that on CNN or something. I don't know. Dr. Quote would have to. But if I've got a combination of flu, COVID, respiratory, other illnesses, other leaves of absence, because I'm seeing an unusual number of leaves of absence, I have to look at it school by school, classroom by classroom, and make that decision. That's what I'm looking at every day with my staff.
Eileen's got a follow, and I think we're done.
In regards to test to stay that you talked about, the pilot program at Grand Island School, are you saying that you're confused about how it's working because they have a smaller population than your population, that same model of work, and I don't know if that's...
No, I just don't understand. and again, I don't say this like naively. I just say I don't understand how many times a child has to test negative if he or she was exposed to someone who was positive, see, or someone who's actually sick. So you're in a school, every day you're around kids who have been positive or staff who've been positive, so that's why we begin the contact tracing, right? So when we contact trace for that individual and we find that there were at least 50 people that were in close contact for the amount of time that day, more than 4 to 6 hours, because we're in school, whether it be in lunchtime, nurse's office, recess, wherever they were, 50 people. Now, how are they going to get tested? How do they get tested in this program? And how many times before they can come on and be in school? Just once? Because that's not adequate.
It's throughout that, their quarantine period, and if they test negative, they stay in school, and they come.
But they have to test negative every time. But because it's the rapid test, and because we know there's false positives and false negatives, you could test negative and that could be false. And you could test positive and that could be false. How many times is a confident number of straight negatives? Because I can't imagine that it's just once is what I understand. I thought it was 4 or 5 times, 3 times in a row. And then that's quite a number of tests that are needed in a large school system. 193 over a 2-week period, that's a small number. And I don't know what success looks like. I don't know what that means. So that's what I mean by that. This needs to be a lot more explaining to me about it. And frankly, colleagues, my conversation with Dr. Crow is that testing is starting to get to be it's not really, it's past its time. We need to get vaccinated, we need to get boosted, and we need to get a new strategy for Omicron. Because I don't even know if this test catches Omicron yet. We have to see. It's very embryonic. So that's my concern with test to state. Really, no one's really explained it where I really understand it for the number of tests I would need to do it, let alone at home do it, and somehow come in and say, here's for my first kid, here's for my other kid, here's for my other kid. One family, 5 children, what? How many tests is she going to get? And how often is she going to have to do that? So those are some questions. All right, colleagues, I've taken up a lot of your time, but it's important. Let's see if we can keep these communications accurate and factual. And the fact is, we want to come back. We expect to come back today at this point, but we will watch this very closely over the next 2 weeks especially. And then we will be guided by our medical specialists, and I will consult closely with the board chair, who will consult with the board. And together we'll make a consensus decision about this matter. Any other questions? We all clear?
Second update is next Tuesday.
Next Tuesday, second and final for starting on the 3rd. But right now we're starting on the 3rd.
Thank you, everyone.
We're resuming on the 3rd. We're resuming on the 3rd. All right, colleagues, thank you for your time. We appreciate you.